for joining us today for this week's Hometown Hero. Kitty and I are recognizing hometown heroes who have served us during this time, who have stepped out on the front line of service and made a difference. These are true difference makers in our community. And we thank you for joining us as we pray for them. Your prayers have made a difference. So today we'd like to introduce hometown hero Dr. Gene Latortue and thank him for what he's been doing for us and our community during this time. And we'd like to ask him some questions. So join us in welcoming him. Good afternoon, Dr. Latortue. How are you today?
Wonderful. Thank you
Great.
for having me.
You're welcome. You're welcome. We have a few questions for you, and we are so thankful that you're here today on this beautiful day. And thank you for taking time to join us.
Always.
Dr. Gene, I know that there are so many questions to ask you. And as we begin today, as we're taping, Franklin County has 12 cases of COVID, and Titus County has 321. We want to ask you, are you alarmed about the increase?
Yes and no.
Okay.
Yes, because when we look at the numbers we have weeks ago, yes, that's a big increase because we stayed at 1 to 3 for many weeks. But no. Like today, I just was talking to one of the local authority earlier today. We're at 13 now. But compared to the other counties, I think we're doing very well. And I have to applaud all the local officials by working together and trying to contain the spread. For example, when somebody is positive, they will call us and we make sure we reach out to those patients and make sure they understand the option they have, make sure they talk to their physician, and also help them protect themselves and also protect their family members. So I feel very, very, very fortunate that we can also help those people and definitely control the number of patients we have in this county.
Have you seen COVID cases, and what do you do for testing there? Do you do testing at your facility?
I would start with the first part of the question. Yes, unfortunately, we have seen some cases at the office. The first case confirmed in Mount Vernon was diagnosed at the office. And I still remember until today, when I walk in that room, seeing the patient, I knew for sure with his symptoms, temperature was 103, his oxygen level was about 60%, his pulse was about 140, 150. I knew then that was our first case. And of course, we made sure we called the hospital, got him there, and of course, got some help. I'm sure later during the interview, we'll be talking more about some detail about some of the cases. But yeah, that was our first case. And of course, we've been doing more testing now in the office. So every day we'll see 2 or 3 cases that will come back positive. But not directly for the county because we see people from so many different places. We have patients coming from Mount Pleasant, from Sulphur Springs. So our clinic serve many, many, many people. But we do see many cases in the office. We do offer testing now. For the past 6 weeks, we're able to buy the testing kit and able to offer that to our residents here. When the patient calls, for example, with concern of being exposed or thinking, okay, I have symptoms, what should I do? Then my office staff will help them understand, okay, this is what you need to do. So they will come. Now we test them after 3:30 because we don't want to cross-infect. The people will come for like diabetes or a wellness exam. So we close the office to everybody else, but just to see those patients after 3:30, we can offer them to different testings. We do the swab, and the swab we do for patient that would be an active patient. You just get exposed to somebody you think that might be infected, and you think maybe you have some symptoms such as fever or sore throat or some dry cough, then you come to the office, then we'll do a swab for you. But also people who pretty much after 7, 10 days were infected before and want to know if they have developed the antibodies can also be tested at the office where we'll do the blood test, and that will show if you're immune now to the disease. So those two tests can be done, and of course we work them through it, and we make sure that when we call them with the result, we explain to them what the result means, and we also give them the proper guidance how to protect their family.
Dr. Jean, how long does it take to get the results?
For the blood, it takes 24 hours or less.
Okay.
For the swab, 2-3 days. And now we're seeing the turnaround is about even less than 2 days, and depending on how many you send out sometimes.
You were going into a lot of detail earlier about what you do at 3:30 in the afternoon to get ready for any potential COVID cases that might be coming in, and I think people would find that interesting. Could you just detail that right quick for us?
Yes, usually, like I could do on a regular day, we come to the office at 8. From 8 to 3:30, everybody is in their regular clothes, myself in my suit and my ties as usual. But at 3:30, we take everything off pretty much. All the suit, the ties, everything come off. And we have to put, we have a special jumpsuit we wear. We have N95, we have the shoe covers, of face shield. So we have to be covered from head to toe. And of course gloves, because we don't want to go home and bring anything to our family or to our friends.
You're in full
Right.
hazmat gear
Yes.
when
Yes.
after 3:30 in the afternoon when
Yes.
you know someone is coming
Yes.
in. But the rest of your patients, that's a very a reassuring word too.
Yes, it's important because you don't want to come to the office and know at some point you can be exposed to anybody
right.
that could
Right.
be
That's right.
having symptoms and could be positive. So that's why we made that decision to make sure we protect everybody.
It seems, though, that a lot of people in Franklin County are not wearing masks. And perhaps that's because, wonderfully, our numbers have been low. But what is your opinion about that as a doctor?
Sadly enough, the mask has become a political tool. But I'm so happy that you mentioned as a doctor, because I think to me, we're going to try to stay away from politics
Yeah.
and focus on science.
Yes.
Yes, I think all the studies have been done and made even before COVID-19, because there's different other SARS that they have studied in the past, that the mask definitely help. And if you go and look at the CDC guidelines, they strongly encourage people to wear the mask for several reasons. For example, if you have the virus and you have no symptoms, many people don't. And we see so many people who come to the office because they just want to know if they have it. And we do the test, and oh my gosh, yes, they turn out to be positive. So you don't know if you have it. So imagine that you have an elderly parent, you have family members who go into cancer treatment, or you have a small child at home. So you don't want to do that to protect them. And also any friend that you can just go say, I'm not going to do it. I want to tell people, just do it not for yourself. Sometimes just do it for your neighbor, for your friends, for a family
Right.
member, for another patient. Because we have to look at the science of it and see how to protect not only yourself, but also protect somebody else.
And so you are saying it has been definitely proven that the mask helps.
Yes.
And according to the CDC, because the messaging on that nationally has been mixed. It's gone back and forth a little bit, not from the CDC necessarily, but in the political realm.
Many people don't know that. I have a master in public health. That's the second degree I have. Many people don't know if I have that degree. Yes, I have an MPH, and I've been studying diseases and prevention for years, for 20 plus years. You have to go by those guidelines, and we have to understand that in prevention, it's not about what I have, it's what I don't want to have.
Right.
So you want to make sure that you're able to protect everybody. Myself, for example, I know I don't have it, but if you come to me, by respect for you, I have to wear my mask, not because I don't know who I get in contact with hour before you came to me. So I have to make sure that I wear that just to protect you as a patient, as a friend.
We appreciate that.
And we thank you for that, for
Yeah.
respecting others. So, Dr. Jean, during this unprecedented time in our history, like you've never seen anything like this in all your years, what positive things have you seen during this time?
A lot of it. For example, I talk to a lot of patients. As you know, I see a lot of patients a day, even talking to family members. Many people have been staying home, and of course, staying home, that gives you the time to think about things, to think about, oh my gosh, I've been missing, my family for so long. I haven't had time so much to watch a movie with them, or to pray with them. And people, I think, now understand that the power of God more than before. I think when human beings get scared, I think they turn more toward God. And I think people now, in terms of faith, I think has helped them turn and pray more. And people walking more. Even in my neighborhood now, I've seen people, family members, walking down down the street, walking out more. People are at home enjoying their family. More talking. We're talking more as we never had time to do before. Before was more texting. Now we can. You're right there. We got to talk to each other. So I think that has been a positive thing for us in terms of society, that we can enjoy each other and talk more, and pretty much understand what we're here for, and
That's
definitely pray more.
Good answer.
Dr. Jean, how can we pray for you and your staff during this time?
The COVID-19 going to take a toll on most people physically and mentally. So I think in that time, we all of us, especially frontline workers, such as EMS or firefighters or police officers, people working in doctors' offices or bookstores workers, physically, because it is so hard, and just knowing that if you get sick, how hard it's going to be on you, on your body. So I think the prayers, that pretty much what's going to help us get through that and protect us from contracting something like that. And of course, mentally, as I said before, because staying at home, many people are going to go to depression, to anxiety, because many kids cannot see their friends. Many people cannot see their family members or their grandkids, and people get depressed from that. So we need that mental health as well. And to tell the truth, the best way to improve mental health is to prayers, meditation. So we definitely need to pray for each other, and I really appreciate you guys' prayers, and of course for everybody, for the whole country.
Well, we definitely will be praying for you, as well as anyone listening to this, when we just appreciate what you and your staff and all the nurses and everyone on the front line of healthcare has done. It's been so wonderful to see us work as a team. You mentioned that, and really we all have, coming together, but thank you for being a hometown hero.
Absolutely. Dr. Jean, I have one more question.
Yes.
Did you ever even imagine you would see a time like this in your practice?
No. And this is why, even choosing my profession, I remember when I was going to medical school, when I had to make that choice, it was about faith. Medicine to me always has been a calling, never a profession, because you always have to be ready for things like that, even though you don't know if it will never happen. But knowing that you chose a profession because it was a calling, and you know for sure that God will give you that guidance and will give you those healing hands, so you know for sure you're not going to be scared. You'll be able to go and perform and do well. But no, I never expected that. But we are ready because we believe in God, and we believe our faith is going to carry us through.
I know from just previous talks with you and Marie that you did feel called to Mount Vernon. And I want you to know, in the 12 years you've been here, and you used the word, I believe, invest a while ago, how much we appreciate your investment professionally, medically, but just personally in Mount Vernon and Franklin County and in the whole area. Because Dr. Jean, You came from New York, New York City to Mount Vernon. That had to be an adjustment, trusting that this would be a place you could call home, which you have. And you and Marie have dug in. And now your roots go deep. And you have made our lives so much better. You didn't just bring your medical expertise, but you brought, both of you, brought your gift of encouragement to us. How many times have I walked into your office and you've smiled just like that and laughed and said, we'll have you better by tonight.
Yes.
And it always happens.
Yes.
And we want you to know how much we appreciate that calling, and you're acting on that calling to come to Mount Vernon, Texas, because I know in some ways it must have seemed like the end of the world and a far-off place. Thank you for trusting the Lord for that. And we would like to present you with our key that we've given each of our hometown heroes. And Dr. Jean, this is a key that signifies revival and dedication and a heart that cares. And we thank you so much for being that in Mount Vernon. We love you.
Thank you.
We do
guys
love
too.
you. Thank you
I
so
appreciate you
much for
guys.
saying yes and coming when you did.
Thank you.